But the second hit that comes in the risk for heart disease, that actually comes from lifestyle. Indians are actually a little more predisposed to heart disease and maybe a little younger than the Western counterparts. Future of wearable devices is absolutely amazing. They're getting slimmer, they are getting more sophisticated, they're getting more easy to use.
Ladies and gentlemen, welcome to the Health Watch powered by Samsung Health. I'm your host, Raisha Sehgal, for this very special podcast. And today we will be talking about a topic which is very close to all our hearts. It's the prevalence of heart-related issues and how the advent of wearable devices can help us mitigate this very challenge. Well, gone are the days when heart-related issues were linked to the elderly people or people with perhaps erratic lifestyle. In contemporary times, in today's day and age, people who look seemingly healthy or even youngsters, they also are going through heart-related issues. So what are the reasons? Is it the changing lifestyle, the erratic lifestyle, or the lack of awareness? And how can this be mitigated? Can timely monitoring through wearable devices and corrective measures help us mitigate this challenge? Well, I'm no expert, but we have an expert here with us today. We have with us Dr. Smita, who's a leading cardiologist. She has 15 years experience in cardiology, and she's also written around 150 articles in peer-reviewed journal. Thank you so much to be here with us today, Dr. Smita.
Thank you so much for having me here, Aisha, and thank you for giving me this opportunity to talk about something that is so close to my heart too.
Right, Dr. Smita, it's a pleasure to have your expertise today. So let's just dive right in. To begin with, talk to us about the global scenario when it comes to heart-related issues. And you're also a practicing international cardiologist. So help us understand what is causing this unprecedented spike.
Right. So, heart disease, or the risk of heart disease as we know it in the population, general population, is something that is present at baseline in every individual. That has to do with the growing age and has to do with genetics, which are pretty much unchangeable. But the second hit that comes in the risk for heart disease, that actually comes from lifestyle. Daily stress, especially with the modern life that we have, being wired all the time, and obviously unhealthy eating habits, Uber lifestyle, fast food joints at every corner. Wherever you go, there's a food joint. So yeah, that doesn't help. So clearly that has contributed immensely to the risk of heart disease globally.
Right. So, Dr. Smita, you did lay down the factors which are attributing to the rise in heart-related issues on a global stage. But let's also talk about where does India stand in comparison to other countries where, like you also mentioned, we are witnessing an uptick in heart-related issues.
As there is a global uptake of fast food, unhealthy lifestyle, India has not been untouched by that.
Right.
You still have everything that's there.
I think it's just a click away now, just on a phone.
It's just on an app, it's available, and people are ordering all the time, 24/7. So that's happening. Unhealthy lifestyle is definitely contributing to that. That being said, there's also a genetic element. There's a higher incidence of heart disease in some populations, even within India. And that has to do with more of an abdominal obesity, which is seen more commonly. There's a higher level of triglycerides in the blood that are seen among Indians, so which is called a metabolic syndrome. So yes, Indians are actually a little more predisposed to heart disease and maybe a little younger than the Western counterparts.
Right. Just to stay on that topic, wherein the advent of heart-related issues in India, help us understand the correlation between diabetes and heart-related issues, and also if diabetes is responsible for the rise in heart-related issues amongst Indians specifically.
Yes. So Indians do have an increased tendency, like I mentioned, of having abdominal mesenteric fat, which then does cause insulin resistance and increased risk for diabetes, which then, of course, is a risk factor itself for heart disease. That being said, there's been increase in technology, and we have been seeing that there have been some pluses that technology has brought for us. And one of them is the advent of screening devices. So initially, it all started with something as simple as a pedometer. And that was the very rudimentary, the very basic form of tracking device. But now we have more sophisticated devices available that can actually track a lot of heart-related parameters as well, and they can give us a whole wealth of information about our heart and about a general well-being or cardiopulmonary health.
Right, and I completely second your opinion on that because I myself am wearing a wearable device, and this is really handy, especially our lifestyles being so hectic and so on the go. This really helps me track my heartbeat, my steps, and all of that. Just moving on from here.
Me too. I wear one all the time. So
we both are wearing
we
one.
both are wearing it.
Talk to us about the irregular heart rhythm and how that's a problem which we are experiencing amongst older adults in today's day and age. Or do you think it only affects elderly and not young people?
Right. That's a very great question, Raisha. So irregular heartbeat is pretty common. And yes, you're very right that it does affect older people more compared to the younger ones. But there are some genetic predispositions in which even younger population can actually have atrial fibrillation. Atrial fibrillation is just an irregular heartbeat that generates not from a normal pacemaker or a God-given pacemaker, but actually is generated erratically within the heart. So heart actually just quivers over there, does not generate a good impulse, does not generate a good squeeze. So the blood kind of pools in the heart and clots. So there's a risk of stroke, there's a risk of heart failure. So overall, it's a bad condition. It's a very risky condition for the heart. Knowing early on about atrial fibrillation or early detection, early screening can go a long way in reducing the burden of atrial fibrillation. Now, coming back to your question about the younger population, they come to me all the time in my office to say, hey, my dad recently got diagnosed with atrial fibrillation. And what am I supposed to do? Because I feel I have the risk of atrial fibrillation too. Well, there comes the role of something which is wearable. And you can wear through the day, which kind of monitors or screens your heartbeat all day long, 24/7, 365 days, and you can get that information. And if there's any abnormality, you can then contact your general practitioner or your cardiologist. That being said, I want to put that disclaimer out that this is just a screening tool. This final diagnosis of atrial fibrillation has to be made by a doctor in the office using what is called a 12-lead electrocardiogram.
Just taking that point forward of the irregular heart rhythm, I want to ask you that why is heart monitoring so important?
So heart rate monitoring is nowadays available easily with just using a device that you can wear for monitoring time, monitoring activities, keeping your appointments, receiving messages, receiving phone calls. This is an extra bonus. You can also track your heart. So what it does is, say for example for you, Rahisha, it identifies your baseline. So it says Rahisha lives between 70 and 75 beats per minute all the time, day long, and then at night she probably drops around 40 and 50 depending on how peaceful sleep she gets at night.
Okay.
Now it identifies that as your baseline. If there is any deviation from that, it's going to pick that up. Yes, it's going to notify you that there has been a deviation and that you should look into it. So that's when you actually download your data, look into it and see what has changed. And that would give you maybe a good information. So that change in the heart rate variability may be something very useful for you. Because that may be an early sign of a developing heart disease.
I agree with you because in today's day and age when we're living such a fast-paced life, health generally takes a backseat. So maybe wearing a wearable device can help us be more aware about our own health. Taking that point forward, help us understand more the role of wearable devices in detecting irregular heart rhythm. And you've been practicing cardiology for 15 years. If you can share some instances or experiences with us.
Yeah. So, when it started off, smartwatches, fitness trackers, a few years back, 4 or 5 years ago, they were not this sophisticated and they were picking up a lot of noise. and artifacts. So the data that was brought to us was pretty much garbled. But I think it is honed a little bit, and now the data that we're getting is much better, much superior. On a personal note, I have been able to detect over the last 1 year, I've been able to detect 3 or 4 patients who actually came into my office with printouts of their ECG from this smartwatch. And basically they wanted me to look at it because it said atrial fibrillation on there. And clearly they wanted to have it looked at. And when I looked at it, yes, lo and behold, it was AFib on that ECG. Okay. I had to do the next step, which is a formal monitoring device, which is a Holter monitor or a cardiac event monitor that they wore for 7 days or 14 days, depending on how their preference. And then we were able to actually diagnose them with atrial fibrillation and treat them accordingly.
Right, doctor, we did touch a lot upon how wearable devices help us detect heart rate and ECG, but beyond both of these, what other health parameters can people track using wearable devices?
A lot, actually. Wearable devices can be a storehouse of health parameters, and they can be used as early screening tools for a lot of problems. So starting right off with oxygen levels in the blood, VO2 max, which is the cardiopulmonary health, sleep quality, sleep duration, steadiness of the gait. So those are some of the very useful things that you can actually parameters that you can actually get from a smartwatch or from a fitness tracking device.
But I'm more curious to know about your health regime. Do you think technology is playing a good cop in your life? And how do you think wearable devices, it is rather helping you monitor your heart rate?
That's a great question, Raisha. So I try to hit the gym and try to get my exercise about 200 minutes every week at least. So I try to do that on a weekly basis. And the smartwatch that I wear helps me in that it gives me the incentive to keep exercising. On a personal note, I did have an issue, and actually the smartwatch did help me. And this is a true story, by the way. So what happened was right after my pregnancy, I was in the gym, and I note that I get a notification on my smartwatch, and it says that there is a change in your baseline heart rate. So I go home, I look at my the data from the smartwatch, and I find that my heart rate is actually now sitting at a higher level than what it was previously.
And you got to know all this just because of a wearable device?
Yes. So my resting heart rate was 102. Which is clearly out of the normal. So I was concerned, and I went to my doctor, and they told me that I did have hyperthyroid post-pregnancy. But it's just that it helped me pick up that early on, prevented me from having complications from it. So for me personally, that's a personal story where smartwatch did help me.
So doctor, before we wrap up today's session, I just want to ask you one last question. As a seasoned professional and a leading cardiologist on an international stage, how perhaps do you foresee the future of wearable devices?
Raisha, the future of wearable devices is absolutely amazing, and the scope of these devices is going to increase day by day. They're getting slimmer, they are getting more sophisticated, they're getting more easy to use, and they're getting smarter as we speak. They are being used, they are going to be used in a lot of other places. The research is currently ongoing. For me, I think what is really interesting to see is how they're going to be used in an outpatient setting, where I can actually monitor the dose of the medications of my patients just using the data that they transmit to me. So I think there is a lot of potential there, and especially the marriage between artificial intelligence and the wearable devices is going to just explode. Overall, since they give so much of data, so much of information, I think they are a useful investment to make in a person's life if they would like to consider it.
I absolutely agree, Dr. Smith. I think a wearable devices like what we are wearing, it really does help track our health. that too living in a very fast-paced life that we are living in today's time. But thank you so much for being here with us today and sharing your insights, your journey, your anecdotes with us. And I'm sure the audiences will grasp something or the other and will be more aware about their own health.
Thank you so much. Thank you for having me, Raisha.
And with that, we come towards the end of this podcast on the Health Watch. We'll be back yet again with another podcast. Till then, stay healthy, stay safe.